And they can get more information on that at the Leapfrog Group's website. We'll be sure to tag that here on the podcast. And I think it's great that you're recognizing excellence in those organizations. And I applaud the efforts to get together a group of innovators. It really closes the loop. So you identify where there may be challenges, and then you make some recommendations of potential solutions that might help a facility turn around their grading system or the grade that they've achieved from a patient safety standpoint. I think that's fantastic. Well, let's talk a little bit about innovation, Paul. You've been an infection prevention innovator for quite some time. I know you hold several patents, and at Next Level Strategies, you're working with other innovators in healthcare solutions. What can you tell us about that?
Yeah, no, it's exciting. I've been fortunate to have had experience in bringing disruptive technologies to market. Probably the first experience I had was the honor and privilege to work for the Purell company, Gojo. And I led the launch of Purell, both in the institutional market, in the hospital and nursing home market back in the 80s, and then in the North American consumer market in the 90s. And, it was really interesting bringing that technology to market. When I first walked in the hospitals with alcohol hand sanitizer, they said, "Oh, no, we're never going to use that stuff. We use soap and water." And of course, it became standard of care. So I'm really excited when I find companies who have emerging technologies that may, in fact, become future standard of care. So it's really exciting to be able to work with those companies. One of them is a really interesting company and technology that solves a problem that exists in healthcare organizations way beyond their category. And that's a way to embed and drive proper behavior against its standard. And so one of the companies I work with is SureWash, and they've solved this problem of how to embed proper hand hygiene technique. You think about it, Leapfrog has a hand hygiene standard, which requires up to 200 observations per unit per month. And that's been driving a lot of interest in the electronic hand hygiene compliance monitoring systems. And but think about it, you want to measure hand hygiene accurately, of course, but what about ensuring that the technique is properly taught and embedded within the healthcare worker organization? And that's where their technology comes into play. What they've done is they've incorporated something called gesture recognition technology that was originally used to train surgeons. And that's just a combination of this artificial intelligence with video cameras that can actually detect hand movements and then give feedback, immediate feedback on healthcare worker technique until they get it right. And then the facility can document staff training as required by the Leapfrog standard and other organizations that may have standards and may be inspecting or reviewing hospital performance. So it's really exciting. It's a one-stop solution for delivering both training and assessment of hand hygiene. And the company is a really great company. They measure against the WHO 5 moments and all the proper hand poses that are supposed to be used when you're doing hand hygiene. And then they make the data available for anybody who's doing internal or external audits. So it's really, really interesting technology, great people. There's a great video at their website that walks through the whole thing. And I just think it's brilliant. And I think it's going to be future standard of care, not just in hand hygiene, but I think other companies will develop similar training and education that goes beyond what's available today to ensure that a proper standard of behavior for any task that can result in better outcomes. I think that technology will be emerging.
And of course, the CDC suggests, and it's widely accepted, that hand hygiene is the most important aspect of overall infection prevention. If we can drive our hand hygiene compliance, then we will improve infection prevention outcomes. And of course, education, as we talked about, culture, a big part of that. And I think the SureWash solution plays right into that. So I applaud you for that. And we look forward to hearing more about SureWash and their training and education solution for hand hygiene. So important. Tell us a little bit about SplashBlocker. I found this very interesting. One of those dirty little secrets that maybe we don't like to talk about, but tell us about it.
Yeah, this is really fascinating. I saw a video that was on Fox News, and you may want to put the link there, which didn't talk about SplashBlocker. It just said that the study was done using lasers to show how high the droplets coming out of a toilet can fly. And, hospital toilets don't have lids on them. So when you flush a toilet in the hospital, the plume becomes aerosolized, and it can spread virus, bacteria, or hazardous drugs that may have been in the patient. Let's say in the case of chemotherapy, and then can spread both in the bathroom and outside. So this is actually a significant risk that gets posed to both healthcare workers along with patients and visitors. And it's really interesting because an oncology nurse who learned at a seminar that she was potentially being exposed to toxic chemotherapy drugs, actually invented SplashBlocker. And she and her husband, it's a really interesting story. They developed this device, and they went to a Shark Tank in their town, and the people who are now SplashBlocker saw it and invested in it, bought the rights to it, and are now taking it to market. And it's really interesting that now they've developed some great evidence behind it. There's been 2 peer-reviewed studies. One of them that was just finished showed that the SplashBlocker, which is basically a portable plastic toilet lid, and you use it to cover the toilet, and it stops 94% of the particles coming out of the toilet. And it's been shown that the chemotherapy oncology workers can actually get and absorb the toxic chemotherapy drugs into their body, and this can potentially reduce the risk of that kind of exposure. So there's really 2 use cases for SplashBlocker. One is to prevent the spread of viruses and bacteria to healthcare workers, patients, and visitors, and also to help reduce the risk of exposure on the part of oncology workers to these toxic drugs. So I think as they continue to do research and bring this to market, a number of hospitals are using this across their entire oncology department. Some major organizations are adopting it, and I think this could be best standard of care when it comes to protecting against the risk of toilet plume, which is a problem that I never even thought about. I never even heard about until I saw that video. So something pretty exciting. It's really one last interesting thing is that the Oncology Nursing Society actually recommends using those blue plastic back pads to cover the toilet, and as you can imagine, they get soaked. It's a disposal hazard, and a SplashBlocker can, if a hospital is using that, SplashBlocker can reduce their cost by like 95% over the use of those pads. So a great solution. Very, very happy to be working with them. Great people, really focused on getting the evidence and science right, and just another example of an emerging technology.
Yeah, we need to be careful of those public toilets. I think the science shows that the bacterial virus plume is up to 5 feet. And then, as you said, it becomes aerosolized. So it can really be spread indefinitely through airflow. And the other thing that came out of that, something else for our viewers to be cautious of, and I've always known this was the case, is the hand dryers in the bathroom. Use paper towels. The hand dryers are pushing pathogens onto your clean hands. So be cautious of the toilets in the public restroom and those hand dryers. They're spreading germs. Paul, there's a lot of innovations that are helping to improve outcomes around infection prevention. As you know, and as most of our viewers know, during the COVID pandemic, after years of progress against hospital-acquired infections, we've seen a disturbing turnaround, and hospital-acquired infections have been back on the rise in the last couple of years. A few facilities recently we've seen are starting to turn the tide on that and get back to best practices to help reduce hospital-acquired infections. But talk about the problems and what are the solutions in a macro sense as we continue to develop more solutions and have a greater focus on patient safety.
Yeah, that's really a good topic for discussion. And I think one of the most important things is that organizations, and this is really going to be some of the future some of the future of innovation is to make sure that there is, first of all, very clear standards, and that's another thing that that Leapfrog is doing. They continue to revise their survey and revise their standards against the best available evidence. But you have to have a standard that you expect behavior on, and you've got to do everything you can to reduce variability, because variability is the enemy of high reliability. So anything you can do to make sure that the standards are clear, that the staff is trained properly on those standards, and then there's an auditing process. So whether that's electronic monitoring of hand hygiene compliance or something that tells and determines whether or not somebody cleaned a surface properly, there has to be a way, an effective way to audit performance and give feedback as close to real time as possible to staff so they can adjust their behavior and reduce variability. So from a macro sense, really making sure, A, that the standards are clear, B, that there's a way to measure against those standards, and C, that there's timely feedback to staff. And that really is the way you create a really great culture of safety. And when that starts at the unit and the unit supervisors or managers are embracing that approach, the unit is the building block of the safety culture of the entire hospital or the entire organization. And that's really the bedrock of creating a consistency in performance and making sure that patients and staff and visitors are as safe as possible.
A follow-up to that, Paul, and I'm going to put you on the spot a little bit here. You're one of the OGs of the industry. You've seen it all. You've done it all. Based on your experiences, if you had a magic wand that could change one thing to improve patient outcomes, what would it be?
Well, I think one of the areas that has not got enough attention when it comes to standard setting, I mean, there are a lot of standards, but I think putting it all together in terms of standard and then ways to audit behavior effectively and give feedback is the environment of care. I mean, the environment of care, when you think about it, is such an opportunity for the spread of potentially pathogenic organisms to staff and patients. And so getting those standards right and making sure that there's the right audit process and the right feedback process is something that I think is going to be the future. There's a lot of standards out there now. There's a lot of organizations that have standards and guidelines, but I think that really can get taken to the next level. And to that point, the Leapfrog Group has formed a work group through their Partners Advisory Committee on the environment of care and plans to write a breakthrough monograph on the environment of care. And so I think that's going to be something that will be coming in the future. The work group just got started, and there's a lot of organizations and thought leaders that are participating in that. And I know that your organization is on that work group. And I think that really taking a look at the environment, and that doesn't mean just the hard surfaces, but that means air, that means water, and taking a look at every aspect of the environment and how does it play a potential root cause in the spread of infections and risk of harm. I think getting that right is the future.
I couldn't agree with you more, and really appreciate you being on the show today, Paul. If people want to find out more about Leapfrog or Next Level Strategies or want to get in touch with you, where should they go?
Well, they can certainly write to me at Paul at next-levelstrategies.com. They can go to next-levelstrategies.com. Leapfrog Group is leapfroggroup.org. You can put those links up on the screen. Leapfrog is a great organization for organizations who do have innovations and want to learn more about becoming part of the Innovators for Leapfrog. They can also reach out to me directly, and happy to tell them more about it. And I'm also happy to talk about next level strategies with anybody who might be interested in the way we think, the way we work, and the way we help bring acceleration of growth to organizations who have the right technology to solve some of the nagging problems.
Fantastic. Our guest today has been Paul Alper, CEO of Next Level Strategies and Senior Advisor to the Leapfrog Group. Paul, we really appreciate you being on Clean Talk today. And until next time, this is Brad Whitchurch reminding you to keep it clean.